The next story, the next medical personnel who died from Lassa fever, the touching story of Dr. Abel Obeta and Dr. Samuel Ushena Alieji. Cable News reports. A special investigative project by Cable Newspaper Journalism Foundation in partnership with the Cable, supported by the MacArthur Foundation. The title of the story of the report from the Cable was Buried Dreams: The Doctors Who Died in Their Prime Fighting Lassa Fever, written by Taiwo Adebulu on June 28, 2022. It was posted 9:45 a.m. About Abel Obeta. His father died early. He grew up in a poor family. He was the first of three children and started taking care of his siblings at a very young age. The mother was a petty trader, and the Catholic Diocese of Nsukka offered him scholarship. He finished from St. Teresa's College, Nsukka, where he passed with flying colors and gained admission to UNN to study medicine. He was a vibrant politician in school. Obeta, as he was fondly called, was popular in school, and he finished in 2017, graduated in 2017, and did his internship at the University of Nigeria Teaching Hospital. When he was campaigning to represent junior doctors, the campaign slogan was "Abel is able." That was the campaign slogan. At the University of Nigeria Teaching Hospital, during his internship or housemanship, he met Samuel Ushena Alieji, a Ukraine-trained medical doctor who came to practice in Nigeria. Samuel was also doing internship at the University of Nigeria Teaching Hospital. While Samuel was in Ukraine, he won Mr. Kharkov Beauty pageantry in 2013. An avid lover of tennis, Samuel was athletic and handsome. Abel and Samuel, both of them were from Enugu State, and so they were known as the Enugu Boys. They were always together. For their NYSC, Dr. Abel was posted to Igbohu, a rural agrarian community in Oyo State, in 2020. Remember Igbohu? Remember Sunday Igbohu, the Yoruba nation agitator, is from this Igbohu. So Dr. Abel was posted to Igbohu in Oyo State in 2020. He was working at the General Hospital, while Dr. Samuel was posted to Delta State for his NYSC. While Dr. Abel was working at the General Hospital in Igbohu, he noticed poor healthcare delivery in Igbohu and that many lacked access to healthcare and wanted to do something about it. He discussed this with Dr. Samuel. After the NYSC, while others left Igbohu, Abel decided to stay behind, and Samuel joined him, and they set up a clinic to cater for the underserved members of the community, especially in the area of maternity care. Their new startup was named West Choice Hospital and Maternity, established in January 2021 and incorporated 3 months later on March 8th. They recruited a few staff and operations commenced. Patients trooped to the hospital and they had to expand to a nearby building. Dr. Abel wrote about coronavirus, Lassa fever on his Twitter page at the time, and he called attention to the fact that there was Lassa fever outbreak and that attention should be paid to it, not just on the coronavirus. The report also said that Dr. Abel wrote on his X handle that the mom called him, to talk about the recent outbreak of Lassa fever and advised him to be careful while handling patients. Dr. Abel now wrote, I could feel how worried she was. God bless my mom. Remember, he had lost the father at an early age. One thing to note, Dr. Ahmed Idowu Victor that I mentioned earlier, who died of Lassa fever in 2018 in Kogi State, was a close friend and classmate of Abel, and both of them graduated in 2017. And as I've mentioned, Dr. Victor had barely earned a month's salary from his internship at the Federal Medical Center Lokoja when he was diagnosed with Lassa fever while treating some patients, and he died 48 hours after diagnosis. Victor's friends describe him as a man of valor with dreams of reforming Nigerian health sector, but death snatched him. So that Dr. Victor, close friend of Dr. Abel. So Aminat Tijani, a 19-year-old apprentice at West Choice Hospital, recalled some patients were admitted for malaria symptoms in early February. Then she too felt similar symptoms and became sick. Then another nurse at the hospital, Happiness Owo, was also experiencing similar symptoms. Within a few days, Dr. Abel, Dr. Samuel, Nimota Isiaka, a 20-year-old apprentice at the hospital, also began to show symptoms. So you have Dr. Abel, Dr. Samuel, Aminat Tijani, Happiness Owo, and Nimota Isiaka, and another apprentice. They all began to show symptoms. You know, so the two doctors asked one Dauda Agun Agunpupo, who helped them procure the hospital building, to take them to another hospital at Shaki for better medical treatment. But the condition got worse. The five of them, the two doctors and three other staff, were immediately referred to UCH Ibadan. Yet their condition deteriorated even at UCH. February 28, 2022, Abel died at UCH. The next day, March 1st, 2022, Samuel also succumbed to the illness. Happiness and Imota followed suit. Amina was in a coma for weeks, but she survived. Dr. Abel was 32 years old. Dr. Samuel was 30 years old at the time they died. It was a devastating news to families, colleagues, when they got news of their unfortunate, uh, you know, unfortunate infection with Lassa fever and their subsequent death. The report goes on to say the once booming West Choice Hospital and Maternity became a vacuum. It was fumigated and shut down following the untimely deaths of its founders. These were young men who had who noticed healthcare gap in Igbohu, and instead of going to cities to seek for better, safer jobs, they took the risk of opening a hospital, West Shores Hospital in Igbohu, and they provided care to underserved population. You know, fortunately, they contracted Lassa fever, and both of them died. First Abel, then Samuel. The Enugu boys succumbed to Lassa fever. Very touching story. May their memories be a blessing. May their memories remain a blessing. Next is Dr. Samuel Onyitio Tega.